I remember that it was a Thursday because I was busy seeing patients. I should double check the date, but December 14th. Actually, here, let me just double check that. I have it on my phone. So yes, I do remember this day very well. It was a Thursday, and I was on service. So as an infectious disease doctor, that means I was, spending a lot of my day seeing patients, rounding, talking to them, coming up with diagnosis and treatment plans. But I knew I was getting that vaccine, and clearly it was on the top of my mind all day. So the way it was done is here at Evanston Hospital, there was a big waiting room where we were all sitting kind of socially distant, very anxious, waiting to get the vaccine, signing a lot of paperwork, and all kind of that baseline just buzz of people kind of anxiously talking. And then we just get called back in our rows to go and get the vaccine. I get introduced to Katie, the nurse who gave me the vaccine. And I'm just sitting there, just filled with so many emotions, that kid on Christmas morning feeling of, I can't believe this is finally happening. We've been waiting for this for so long, and now it's here, and I'm going to get this vaccine. And just along with that just sense of relief of like, this is how it ends. This is, we are through, we've gone through so much already. And while clearly this one shot in my one arm is not going to, snap the switch that's going to eliminate COVID, it just represents that tiny step forward. And seeing all these other people around me that I know and respect and work with, doctors, nurses, respiratory therapists, patient care technicians, just a sampling of the entire hospital, all feeling kind of the same thing. And just seeing how that played out for myself and for everybody was just really fantastic. I admit I'm one of the many people who took a selfie of myself getting the vaccine and then sent it to my entire family. And just even their reactions were amazing. Everybody's just, so excited to see somebody that they know getting this vaccine and also just taking that step towards finally reducing the suffering and eliminating so much of the pain and the death and, the isolation that we've all been living with for the past year. It was just really fantastic.
Yeah, it's glimmer of hope from the endless terror of 2020.
Right. I just, felt like that light at the end of the tunnel just suddenly got a lot brighter and a lot closer.
Welcome to the Healthy You podcast from NorthShore University Health System, where we explore trending topics in healthcare. I'm Carolyn Starks.
And I'm Jon Hillenbrand.
Hi, Jon. How are you?
Hi. Welcome, everyone, to our latest episode about the vaccine.
Are you afraid of the COVID-19 vaccine?
I am not. I actually had my first and second doses, and it was very interesting.
Well, today we're going to bust all those myths about the vaccine. And our guest today is Dr. Jennifer Grant, an infectious disease physician with NorthShore. Hi, Jennifer. Welcome.
Hi.
Welcome.
Thank you for having me.
So you were one of our first guests on this podcast when we had, 2 listeners?
Yeah, it was one of our most popular episodes.
It really was a lifetime ago.
It was. And I was looking back at some of those episodes, and I remember physicians would come on, and my way of introducing them was, state your name and what you do at NorthShore.
Very flowy.
No, I would get this response like, Your Honor, I didn't do it.
Right.
So
we've grown. The coronavirus has grown.
Yes, Law and Order was canceled. So
a lot of changes in the last year.
All right. So tell us what you do at NorthShore.
So I'm an infectious disease physician, which involves a lot of different daily tasks. One big thing that I do is see patients in the hospital when other doctors are concerned that they might have an infection that needs to be diagnosed or treated in a specific way. And then another hat that I wear involves infection prevention and control in the hospital, which means just keeping an eye on everything that's going on. Clearly, COVID has been the main thing that we've been worried about over the past year, but other types of infections and threats to the safety of patients within our hospital, but also within the local area.
So you look for like trends that are happening at our hospital and other hospitals.
Exactly.
Interesting.
Truly frontline. So I'm wondering what it was like when you received your first dose of the vaccine.
It was amazing. I felt a little bit like a kid on Christmas morning. I was so excited, and just getting that vaccine, even though it's one dose, one person, I just felt that relief of this is how this ends. This is how we get to the light at the end of the tunnel by getting immunizations into arms, getting people immune to this virus, and kind of really putting an end to the suffering that we've been seeing.
I was photographing people getting the first and second doses, and I did see a lot of that. And I got to say, when I got the first dose, I did not feel that way. It wasn't until right immediately after I got the second dose, and the nurse looked at me and she said how are you doing or something, and I almost started crying.
Right.
I had a lot of emotions built up, and a lot of the nurses around me, I knew them for many years, and everyone was kind of looking at me, and I don't know, it was really interesting, and it was very gratifying and a very positive experience, honestly.
Yes, exactly. And I just still am amazed at how this has come to fruition. I mean, there have definitely been stumbles along the way, but just this, getting this vaccine and so quickly after the onset of this pandemic and being able to get it into people, both within our healthcare system and locally and within the country, it's just, it's really, really impressive.
Yeah, it's truly is remarkable. So let's get started on some of these questions. I'm wondering if you are still seeing that fear of the vaccine or hearing about that fear of the vaccine as much as it was when this first started.
I would say not as much. At the beginning, there was just more unknowns. The very first people getting vaccinated were the first people getting vaccinated. So I do think that there was more hesitancy and fear at that point than now, after we have been vaccinating people in the United States, for almost 2 months and have given over 66 million doses of the vaccine throughout the country. So I do think that hesitancy has waned a little bit, but it has definitely not gone away completely.
Right. So I wanted to run this by you. So there was some safety monitoring data that was listed on the CDC's website for December 14th to the 23rd. And what they did was they detected 21 cases of anaphylaxis after reported administration of 1.83 first doses of the Pfizer vaccine. So roughly 11 cases per million vaccine doses administered. And there was also some non-anaphylaxis allergic reactions. So 11 in 1 million chance is incredibly small, yet people are still worried. So let's talk about what this severe anaphylaxis reaction is, and then address who would be most susceptible to getting that type of reaction.
Sure. So anaphylaxis is a severe and potentially life-threatening allergic reaction that can affect your whole body. And it is caused by a lot of different things, including things we do in healthcare, like certain medications, dyes that we might use for CAT scans, insect bites, foods, all sorts of things can cause anaphylaxis. And the symptoms can really go head to toe, but they include skin symptoms like flushing, hives, swelling of your lips, breathing symptoms like not being able to breathe or wheezing or feeling like your throat is closing, stomach symptoms like having the onset of, pretty violent cramping, diarrhea, nausea, and then cardiovascular symptoms like having low blood pressure and a very fast heart rate. And those are really the signs that we have to worry about and that require people to be treated rather urgently for anaphylaxis. And that's an important note that it is treatable. If it's identified quickly, people get medications and supportive care, and it's not something that has permanent effects after, the allergic episode happens.
So let's talk about who would be the perfect candidate, I guess, for this to happen. A lot of people have food allergies, peanuts, milk, eggs, shellfish. Is that the group that we're talking about?
So in the CDC data that you referenced, they've done even further analysis, and they've looked back through these cases of anaphylaxis that occurred. And I think at this point, one of the more recent studies had 85 cases. And it is true that the majority of those people did have a prior allergy to something. But the list of those allergies was very wide and variable. You know, people reporting allergies to medications, to foods like walnuts, to latex, to insect bites or jellyfish stings. So there are these patients that did have anaphylaxis did more commonly have prior allergies.
Right. Or an anaphylaxis reaction
including
before?
Anaphylaxis. So the majority of them had allergies. About a third of them had prior anaphylaxis. And what that means is that those people that have had prior anaphylaxis, they get monitored for a longer period of time after the vaccine. They get monitored for 30 minutes. Everybody else, including all of us that have had allergies to other things, we get monitored for 15 minutes. And the reasoning is that the vast majority of these reactions, these anaphylactic reactions, occur in that period.
In that 15-minute
Most of the most common time of onset reported is about 10 minutes is when people start feeling these symptoms. Majority of them occur within that 15-minute window, and then 90% of them occur in that 30-minute window.
Okay. So the one thing we know for sure is that those that did have a severe reaction had some type of prior similar severe reaction in their lives.
A third of them had a prior anaphylaxis, like one of those very severe allergic reactions.
Okay. Or a history of allergies or allergics.
Yes.
Yeah, to something.
But does the comparison go the other way? Like if you've had anaphylaxis in the past, does that mean you will have anaphylactic reaction?
No, good point. Definitely not. The vast majority of people who have allergies or anaphylaxis do not have a reaction to this vaccine.
Okay. So people who carry an EpiPen around, for example, those are people who should still get vaccinated, but say, I might need to stay here for 30 minutes.
Exactly.
Okay.
Exactly.
So let's talk about these ingredients then in the vaccine, because I'm curious to know if we know what people are reacting to.
Yes, that's a very good question. So right now, what we think the culprit, or one of the main culprits, is this compound called polyethylene glycol. It's used in the lipid, which is kind of the outer coating of this particle in the vaccine. And that is actually a substance that maybe our listeners are familiar with. It's a common ingredient in laxatives like Miralax or certain types of preparations that people get before a colonoscopy. So if you are one of those individuals that has had a severe allergic reaction in the past to polyethylene glycol or to another related component called polysorbate, you should not get the vaccine. That is definitely something that we know about and that we're asking patients about or individuals about before they come to get the vaccine.
Is that why they ask you when you get vaccinated, do you take Miralax or something like that? I think they were asking.
That's definitely probably why they are asking that, because Miralax includes that that polyethylene glycol compound.
Do you know of anything else this might be in?
So what I'm most familiar with is it in Miralax and colonoscopy prep. I do believe there are these kind of related compounds called polysorbates that are actually fairly widely used in things like food additives. They're things that are added to foods to have them keep a good consistency. So they are, some of these products are kind of pretty widely used.
Okay. And this is just this is used like a lipid, like you said, to encase the particle of the vaccine?
It encases that mRNA, that kind of recipe that we give in the vaccine that makes your body produce the antibodies or produce the protein. And around that mRNA are these things called lipids. And that's where the polyethylene glycol fits in. Okay.
So they could be in a liquid and, injected and that kind of thing.
Yes.
Okay. And still these are so rare. Do we even know how many numbers? If we've given 66 million.
Yeah. So the analysis that I am most familiar with identified 85 cases of anaphylaxis after looking at over 18 million doses of the vaccine. And that worked out to be 4.57 episodes of anaphylaxis for every million doses of the Pfizer vaccine, and a little bit less, 2.5 episodes for every million doses of the Moderna vaccine. And just to give our listeners a little perspective, that is higher than rates of anaphylaxis from prior vaccines, which are estimated at around 1 per every million dose of prior vaccines. But it is far less than anaphylaxis that has been attributed to certain types of antibiotics, like in the penicillin family, or that contrast dye that people sometimes get for CT scan, whereas that number is closer to 200, episodes for every million exposures to that
much higher,
antibiotic.
Oh, wow.
So it is substantially higher for other common things that we do in medicine, sometimes without blinking an eye.
Okay, and so it's much less frequent than what I mentioned in the beginning of the podcast, because that was just a window of time in December.
Right.
And they will continue to look at this, and those numbers will probably continue to change. I guess a caveat for this whole podcast that things are going to continue to change. So what I say now might, these numbers might be very different several months from now, but this is the updated data that we have now.
Did you have a reaction?
So I didn't have an allergic reaction, definitely did not have an anaphylactic reaction, but I did have one of the very, very common reactions, one of the local reactions of my arm hurting.
Yeah, me too.
I felt like my arm hurt for 5 or 6 days, like I had been punched, and it was just, one of those, like when you're washing your hair, you feel it, and,
What about with the second dose?
With the second dose, fairly similar. My arm hurt again, actually didn't hurt as long, and I just felt a little tired and a little bit of a headache, but I didn't suffer in any way.
Did you feel cheated? Like, where's my fever?
Right. No, I was just very happy not to have a fever. But yes, you make a good point. I mean, people are celebrating these immune reactions sometimes. Like, I got a fever. I know it's working, which is a really, fun aspect of this.
And you should clarify that if you don't have a reaction, doesn't mean it's not working.
Exactly. It does not mean it's not working.
It just means that you're healthier and superhuman and super. No.
Maybe. Yes, we can definitely talk a little bit about those reactions.
Yeah, let's.
So we kind of divide them up into these local reactions and then the more systemic reactions. The local reactions are things like your arm hurting, it getting a little swollen or a little bit red, or even getting actually a swollen lymph node in your armpit on the side where you had that vaccine. And it's actually estimated that around 90% of people probably have one of these local reactions, 80 to 90%. The other group of reactions is kind of classified as a systemic reaction, meaning like your whole body is, reacting to this. And those types of symptoms include fatigue, headache, fevers, chills, body aches, just feeling run down and kind of lousy after getting the vaccine. And those are also still quite common. Estimated around 50 to 80% of people will have at least one of those, with fatigue being the most common. These symptoms are essentially just they're your body telling you that it's reacting to this vaccine. It's your body's immune system doing its job, producing this protein and these antibodies to protect you against the coronavirus. But if you don't have these severe symptoms, it doesn't mean that the vaccine is not working.
Can you talk a little bit about some of these cases we've heard of, for example, Bell's palsy?
Yeah, sure. So Bell's palsy is a temporary kind of paralysis of one of the nerves leading to your face. And so the way that it's recognized is people's facial muscles get a little bit droopy. They might not be able to fully open their eyes or open their mouth, and it typically only happens on one side of your face. And Bell's palsy is something that we've known about this for a long time, and it often happens for reasons that we don't clearly understand. There are some triggers that we know about, certain types of infections, stress perhaps, but we don't always know why. And early after the vaccine rollout was beginning in the United States, there were reports of people experiencing Bell's palsy after getting a COVID vaccine. So with Bell's palsy and all sorts of other types of reaction, what happens is the CDC is collecting this data. They're collecting it from individuals, from healthcare organizations, any type of reaction happening after the vaccine gets reported to them. And then it's their job to kind of distill this data. And for instance, with Bell's palsy, after they've distilled all the data, they really see that there's no increased frequency of Bell's palsy in people who are vaccinated. The baseline rate of Bell's palsy is the same as the rate of Bell's palsy and people are getting vaccinated. So the vaccine seems to have no effect or cause, towards Bell's palsy.
So people are just getting Bell's palsy for whatever reason.
For any old reason, the same reason they would have gotten it had they not been vaccinated.
Interesting.
And that's a temporary condition.
Exactly. Yes, it goes away on its own.
Can you tell us a little bit about if you have some type of reaction, which is normal, the fever or the chills or body aches, how long would that last?
So yeah, most of the time these symptoms start about 24 to 48 hours after you get the dose of the vaccine and only last, 1 to 2 days, maybe sometimes up to 3 days. So They are short-lived. You might feel pretty lousy while they're ongoing, but they are definitely temporary and don't mean that there's any lasting effects that you would have after that.
Should it prompt a call to the doctor or no?
Yeah, I think that's a good question. It probably depends on your other underlying health conditions and what's going on. If you are someone who is otherwise healthy and you know that you got this vaccine, you're having something that feels exactly like, what we have been describing in terms of a vaccine, it's probably okay to wait it out. Now, this is probably different if you have a lot of underlying medical conditions or, something else that you're worried about and you're not sure if it's a vaccine reaction or potentially this other thing that's causing your symptoms. In those cases, a call to the doctor would be appropriate.
I'm a relatively healthy person, and after the second vaccine dose, I had soreness in my arm, but not bad at all, especially compared to the first dose. And then it wasn't until about a little less than 2 weeks after the second dose where I was super tired and kind of brain foggy, and I couldn't think straight. And I actually ended up taking the day off from work. But then after that, I'm 100%.
Yeah.
So, yeah, it definitely went away. But I was wondering, is this, related? Because it's been almost 2 weeks,
It's hard to say. Most of the reactions are definitely in that shorter window. We've been telling people to watch out for it up to a week after the vaccine, but the body is always throwing us surprises.
Right.
So,
And there's a lot of other things happening across America, and I know even with me where I'll stay up too late, or I'll just have bad sleep habits in general, or a stuffed up nose from the weather changes. So who knows, what's going on.
Exactly.
It's all different factoring
right.
in.
Yes.
I also think where you're looking for something, you will find it.
Yeah.
So we're so laser focused on this particular vaccine and the reactions. And some of them seem, from what you're saying, common in other vaccines that we've never had this kind of public discourse about.
Right.
Oh, that's so true. When you think about the arm pain, for instance, like the tetanus booster, the tetanus pertussis Tdap shot, that's a very common cause of arm pain.
Yeah.
And the shingles vaccine, I remember my dad telling me when he got his Shingrix vaccine that he just felt really terrible, for about 24 hours after getting that. But we are not all hyper-focused on tetanus or pertussis or shingles right now.
Right.
So those things are, just kind of in the background.
And everyone's just talking about it.
Yes.
Yeah. The other important topic I wanted to bring up, our question is, I've read that women, especially those in their 20s and 30s, are more likely than men to turn down the vaccine. And there is this misinformation out there, I should say, about the vaccine affecting fertility. And it has just enough science in there to seem plausible to somebody who is not a medical health professional. So can you help us debunk this myth?
I would love to debunk this myth.
I thought you would.
I heard this one early on, too.
Yes. Early on after, the vaccines were approved, we started seeing misinformation on the internet that the protein that this mRNA recipe makes, the spike protein, is very similar to a protein that's involved in the placenta in a pregnant woman. And so this then led to concerns that your body is going to make antibodies that will attack that protein of the placenta and cause infertility or pregnancy loss. Now, in reality, the proteins are quite different, and actually structurally, the shape of the protein that the antibody kind of makes itself to, they're really very, very different. So the science behind this, even theoretically, is not valid. Now, it's true that data on vaccinations in pregnant women is limited. It is forthcoming, but we do have some data from both the Pfizer and the Moderna trials. And in both of those trials, a small number, about 36% of women did get pregnant, half in the placebo group and half in the vaccine group. And there were no pregnancy adverse effects that happened in those women who had gotten vaccinated and then got pregnant. No, that we're aware of, no pregnancy losses or any adverse effects for the fetus.
And certainly people are getting pregnant now, and we vaccinated 66 million people.
Exactly. And that is a really good point. The American College of Obstetricians and Gynecologists say that we should not just ignore pregnant women in this push to vaccinate, and it should really be a discussion with your doctor based on the risks and benefits, and the potential risk of the vaccine are, minimal, if not zero, to the pregnant woman or to the fetus.
It would not affect male fertility either, correct?
Right. No, there is no data that it affects male fertility in any way.
Because I did hear this about a year ago from a mom who said, I'm going to caution my children ages 20 not to get the vaccine because it may affect fertility.
I think this is just one of those, myths and things out there that gets started, like you said, with just a little bit of science and then kind of takes over because it's this new vaccine. And yes, of course, there's going to be people who are skeptical or concerned. And you should, pay very close attention to these things and, to your health and not do things blindly, but rely on the science. And right now, the science really tells us that there's no risk for fertility with this vaccine.
I also think people or society is just using their imagination a lot of times because of pop culture and movies. And that movie Children of Men had this situation where everyone was infertile on Earth, and the zombie apocalypse video games and movies have been so popular for so many years, and people are just looking for like, okay, is this like that game I played? Like people
Yes.
are looking for, this realization of things that they've been exposed to for so many years.
Although it's kind of funny, like you would think, isn't a global pandemic like bad enough? Like,
Yeah, right. Let's not make it worse.
This is the, science fiction come to life right now,
Right.
this global pandemic. Let's not look for,
my God,
for
the
these other
zombie
problems.
apocalypse. Yeah.
Let's take it up a notch, everyone.
Yes.
All right. Is there anybody who should not get vaccinated? I know you mentioned a group, but can you repeat that?
Yes. So there are a couple groups that should not get vaccinated. The first one is if you do have one of those anaphylactic reactions to the first dose of the COVID vaccine, you shouldn't receive the second one. And this is because the two vaccines that are approved under emergency use in the U.S., the Pfizer and the Moderna, are both these mRNA vaccines that use, similar ingredients. This may change as we get more vaccines, but right now, if you have that allergic reaction, that anaphylactic reaction to the first vaccine, you shouldn't get a second dose of either of the vaccines. The second group is the group that we mentioned who have a known allergy to polyethylene glycol or to polysorbate. And kind of as we talked about anaphylaxis before, there's a third group that aren't, it's not a contraindication for them to get the vaccine, but they should just discuss it with their doctor. And that's a group of people that have had an anaphylactic reaction to an injectable medication before. In this group of people, the CDC does recommend that they talk to their doctor, maybe even an allergist, to kind of come up with a plan, but that it's not a total contraindication to getting the vaccine. It's just one, you would do it closely and in a monitored setting.
Another big myth that I hear is, how did the government fast track a vaccine?
Yes.
A safe vaccine.
Exactly. I think that there are a couple key themes to this. The first one is there was a little bit of luck. The second is that there's a lot of money. And then obviously there was just this intense pressure. We're, in the middle of a pandemic. And to the luck, I mean, the technology that we're using now, these mRNA vaccines, this wasn't just completely created, out of nothing with the onset of COVID. This technology has been studied for a long time, and it just kind of provided this really great avenue to develop a vaccine more quickly. This technology allows us to make the vaccine itself much more quickly than older technologies where we would have to grow the virus, for instance. So, the fact that we had this technology kind of ready to go and we were able to develop the vaccine quickly, that's putting us ahead a little bit. The second issue is just that the money and the pressure kind of going into this. Private companies and the federal government put a ton of money into this to allow these pharmaceutical companies to really speed things up. So any human trial includes 3 stages, and all 3 stages happened in these vaccine trials. They just happened faster and kind of in an overlapping fashion, which allowed the timeline to just be really compressed.
And you're talking about the checkpoints.
Exactly. So, there's each stage of the vaccine trial includes increasing sizes of people and kind of increasing scope. So they start small and then do a little bit more people and then, a much larger group of people, thousands of people getting vaccinated. But they were able to really kind of do this very quickly because they were able to take some financial risks. the government, with this funding, gave the pharmaceutical companies some leeway to not worry so much about the money incentives in this process.
And if there was any kind of indication that it was not safe, then it gets stopped and shut down.
Exactly.
And that did happen with other vaccines.
Oh, of course. We saw those news reports, that anytime there was an adverse, event that would happen with any kind of vaccine trial. And again, we wouldn't really be hyper vigilant or, aware of that. But when these events did happen, they paused the vaccine trials and they analyzed all the data and then came to the conclusion that it wasn't related to the vaccine and proceeded again. So all of the safety checkpoints happened the same way as they would in any vaccine development. Regulatory processes were sped up too. The FDA and ACIP meetings happened much faster than they would normally after we got this data. But the FDA still reviewed the data with a fine-tooth comb like they would for, any approval of a vaccine or a medication.
If people want to know more about how the coronavirus vaccine was developed, we actually did a podcast episode on that called The Science Behind the Coronavirus Vaccine. It's August 26th is the date.
That's right, with Dr. Nirav Shah, and he was excellent. So I have a 17-year-old, and a 20-year-old, and they will both be vaccinated, and they want to get vaccinated. And at that age group, of course, it's their number one social responsibility is what they feel. What do you tell to moms who are wondering if their children who are age appropriate should get vaccinated?
If your child is over the age of 16 for the Pfizer vaccine, over the age of 18 for the Moderna vaccine, yes, I am totally in support of, these individuals getting vaccinated when they're eligible. I think one of the big issues right now is, that they might not be eligible for a while if they're otherwise healthy, kind of given the priority that we have with the vaccine. And because the main thing we know that the vaccines do is prevent people from getting very severely ill, going to the hospital and dying, we're obviously targeting the people that are much more likely to get very sick, go to the hospital, or die from COVID. And that is very strongly correlated with age. So targeting the, older individuals above 65 and also individuals with underlying conditions are going to be the huge priority before moving down kind of the age chain to people who are young adults.
And I heard that the difference in the ages for the two vaccines is because who they included in their trials.
Exactly. Okay. Yes. The Pfizer study did include a small number of kids under the age of 16, whereas the Moderna study did not.
Okay.
But there are ongoing clinical trials in kids right now. So we should have more data soon.
Which is exciting because I know the age de-escalation is going down maybe to age 12.
Exactly.
Including in the trials. So
yes.
That's exciting.
Do we have information on how long the vaccines are effective?
Unfortunately, we don't know for sure. We just don't have enough time behind us to really know. I mean, although this has been the longest year, in human history, we really have only had these vaccines, being given in clinical trials since the summer, and obviously being given more widespread since December.
Right.
We do know a couple things. We know that natural immunity probably lasts up to 6 to 8 months. And we do have some data so far from Moderna, who did look at antibodies after people received the second dose of their vaccine, about 90 days after, and still had very good levels of neutralizing antibodies. But we just don't have enough time behind us to know how that will carry on into the future.
Well, I'm not going to out this person, but somebody I know said, I was explaining the side effects about the sore arm and stuff, and I described it as being very similar to getting the flu shot, but maybe a little bit more painful. And he proudly proclaimed that he never gets the flu shot. So what would you say to people who maybe aren't anti-vaxxers, but who just don't think the flu shot is important? And what would you say to them about the coronavirus vaccine or the flu vaccine?
Yeah, that's a really good question. And I think one of the issues is trying to get to the root of why they don't want the flu vaccine, because that might be different for the coronavirus. I think people, as individuals, we're always assessing what we think our personal risk is to something. And your personal risk to COVID might be a lot different than it is to the flu. So I think, first of all, getting at the reason why. Do you not get the flu vaccine because you just you think you're invincible and the flu is not going to cause any harm to you? Do you not get the flu vaccine because you're worried about the side effects? I think there's a lot of different reasons why people are hesitant to get vaccines of all different kinds. And it's not a one size fits all approach. You really have to try to kind of dig in a little bit and find out why. And then I think capitalize on the things that are important to people. For instance, for the COVID vaccine, I think the overall social implications of reducing the spread of this virus and, saving lives is huge. Many people have relatives that are older, immunocompromised, who would be potentially, very sick if they got the coronavirus. So I think these issues are a lot more top of mind now with COVID. So I would definitely take an approach where you just really have to kind of sit and have a conversation, and then try to influence people based on all of these other, good reasons to get the COVID vaccine.
You know what?
Absolutely.
I personally would like a front row seat to someone like that mansplaining something to you. I would pay to hear that conversation.
Oh gosh, yes, yes, it happens. It's just you gotta whittle down each complaint or each concern.
Well, kind of meet them where they're at. I should
Exactly.
say.
Yes, that's a good way of putting it.
But you know what? You did bring up a good point, because we're talking in really general terms. But if you wanted to narrow it down, millions of people have their own little anecdotal story. So, for example, which I mentioned earlier before we started recording, a friend of ours, she's decided not to get the vaccine. Her sister-in-law's father-in-law got the vaccine. The next day, he had a heart attack and died. So he's in his 80s and has a history of heart issues. They made that connection and decided, and now they're telling their friends, and she's told someone, and so on and so on and so on. And so now we're getting this group of people who do not want the vaccine.
Yeah. I mean, that's unfortunate. Stories like this are going to happen because we're vaccinating so many people. And there's just a baseline rate of bad things that happen to people for other reasons completely unrelated to the vaccine. So it's this whole idea of causation versus correlation or association. Mm-hmm. Someone got the vaccine and then they passed away. Yes, there's obviously a time, kind of association there, but is it causal? No. And the way we know this is because the CDC is very closely tracking all deaths reported after the vaccine, whether it's, an hour, a day, weeks, months after the vaccine. They're looking at all of these reports and they're going back through and assessing whether there is a potential causal relationship and whether or not deaths are occurring at a higher rate in people who are vaccinated than not vaccinated. And so far, there is no evidence of any deaths directly related to the vaccine. The rate of deaths occurring is no different in people who are vaccinated than the general population. So an 80-year-old person with heart disease, there is just some baseline risk that they might pass away, and it has no impact whether or not they got the vaccine. The vaccine did not have any impact on that.
Yeah, I mean, you could connect it with anything. Like they had a juice box that morning, and then the juice box killed them, because it just doesn't matter.
Right, exactly. I mean, right.
But would an 80-year-old have a juice box?
I mean, if that's all there is to drink.
Well, let's talk about this.
I mean, it's kind of like an injection. You poke it, with a little straw, and
way too much sugar. No one should consume that much sugar in one sitting.
There you go.
So we kind of have an idea of who shouldn't get the vaccine, but there's some things that we're not sure about, like people who are on chemo or people who have already had COVID. Should these people not get the vaccine?
No. I can, I'll talk about those separately. So if you are an immunosuppressed patient because you're on chemotherapy or maybe you're taking a medication that suppresses your immune system, we still recommend that you get the vaccine. We don't know if those medications are going to affect how well the vaccine works, but it is definitely safe for you to get the vaccine. And so our guidance and recommendations are when it is available to you to still get that vaccine. You might want to talk to your doctor if there's any timing concerns based on your chemotherapy or your medications, but it's definitely still recommended that you get the vaccine. And if you've had COVID before, you should also still get the vaccine. obviously you shouldn't get the vaccine if you're actively sick with COVID or in isolation or quarantine. But once you've recovered, it is safe to get the vaccine. There have been no increased risks related to the vaccine in someone who's previously had COVID. And the timing is a little bit, under consideration. Some people would choose to wait 90 days based on what the CDC says you could do because your immune system is probably still protecting you, your own immune system, but you don't have to wait, and you could get the vaccine as soon as it's available to you after you've recovered from your coronavirus.
This is just off the top of my head. If people get the vaccine, would donating blood that's full of the vaccine be a positive, socially responsible thing to do?
You can donate blood. It's actually not the type that would be used for, like the convalescent plasma. Once you've had the vaccine, they're recommending actually not to use that type of convalescent plasma in fighting, COVID in those studies.
Okay, but you can still donate blood.
You can still donate blood, yes.
So the vaccine is free. I mean, well, our taxes are paying for it.
Right, yes.
But I've heard some people saying, like, go see your doctor to make sure that it's the right thing for you to do. Is it mandatory that you see your doctor? And how are hospitals separating the cost of a doctor's visit from the cost of the vaccine, which should be free?
Right. It gets a little sticky. I mean, you're right. The vaccine is free, and it's given to healthcare organizations and hospitals for free. Now, it's not totally free for that healthcare organization or hospital to give it. They have to have the space and the personnel and the supplies needed, and all of that. An
administration
Yes,
cost.
They can charge an administration fee, although what the Illinois Department of Public Health has said is that those fees should be billed to insurance, not directly to the patient, and that no patient should be denied the ability to get a vaccine because they can't afford that administration fee, and that the federal government is actually covering the administration fees for those, for patients who might not be able to afford it.
So go get it.
Yes.
Yeah. All right.
That's great. It's been such a great conversation.
I know. This has really been, I think if we had our choice, this would go on for another hour.
I have so many more questions, but I think we're good.
Just the idea, too, that it's science's proudest moment of recent history, and for you to be such an integral part of it, and for us to get the chance to interview you. And it's just been really a great conversation. And thank you so much for being here.
Awesome.
Yeah.
I didn't even mention that about the vaccine, but that's another thing is you just feel like, wow, I am part of this. You're right. One of science's most amazing moments is this development of this extremely effective and safe vaccine. And I get to be there and witness it firsthand and experience it. It is a great feeling after all of that suffering and endless hours of stress and policies and just fear. That was another good point.
Yeah.
All right. So thank you for being here once again.
Yeah, thank you so much.
Until next time, this has been the Healthy You podcast from NorthShore University Health System.
Stay safe, wear a mask,
and get vaccinated.
And thanks.
Thank you. Thanks.